What if someone looked directly at you and asked why you were inside their home, even though you've cared for them every day for months? Would you argue? Would you correct them? Or would you understand what they were truly feeling? This is the story of Chioma, a Nigerian healthcare assistant working in a residential care home in Manchester, and one patient who taught her one of the most important lessons in dementia care. Meet Chioma Okeke, a compassionate Nigerian healthcare assistant working in a residential care home in Manchester, United Kingdom. One day, she was assigned to care for an 81-year-old resident, Mrs. Eleanor Williams, a retired British school teacher. At first glance, Mrs. Williams appeared perfectly healthy. She smiled warmly. She could hold conversations. She walked slowly around the home. Nothing seemed unusual until Chioma spent more time with her. Some mornings, Mrs. Williams believed she was preparing children for school assembly. She spoke confidently, as though she were still standing in front of a classroom. But on other days, she couldn't remember where she was or why she was there. Sometimes, she looked at Chioma with fear and quietly asked,
"Why are strangers in my house?"
That was when Chioma realized this wasn't ordinary forgetfulness. This was dementia. One evening during dinner, everything changed. Mrs. Williams suddenly became distressed. She shouted across the dining room,
"She's stealing my children!"
Other residents looked frightened. Staff rushed over. One newly employed support worker quietly laughed.
She's just behaving strangely again.
But Chioma saw something everyone else missed. Mrs. Williams wasn't trying to cause trouble. She was confused. She was frightened. Instead of correcting her, Chioma did something different. She walked closer, knelt beside her, and spoke softly.
"Mrs. Williams, you're safe. Let me stay with you."
There was no argument, no raised voice, no attempt to force reality upon her, just reassurance. Slowly, Mrs. Williams's breathing eased, the fear in her eyes faded, and calm returned. Sometimes, kindness is more powerful than correction. Later that night, Mrs. Williams quietly left her room. She began walking toward the exit doors. Chioma noticed immediately. She gently caught up with her. Mrs. Williams looked worried.
"I have to pick up my children from school."
Chioma knew those children were now adults, but correcting her would only increase the distress. Instead, she smiled.
"Let's go together."
Moments later, they were safely walking back to her room. A few days passed, then Chioma noticed something new. Mrs. Williams wasn't eating properly. She slept far more than usual. She barely spoke. At night, she wandered more often. Many people would assume the dementia is getting worse, but Chioma wasn't convinced. She knew sudden changes often mean something else is happening. Some members of staff dismissed the changes.
"It's just the dementia. There isn't much we can do."
But Chioma trusted her observations. She carefully documented every change, then reported them immediately to the supervising nurse. Professional caregivers don't ignore warning signs. They act on them. Mrs. Williams was examined. Blood tests, urine tests, a full medical assessment. The results surprised everyone. She had developed a urinary tract infection. The infection had triggered delirium, making her dementia symptoms appear dramatically worse. The doctor explained that in older adults, even a simple infection can cause sudden confusion, aggression, restlessness, and severe changes in behavior. Without early recognition, her condition could have deteriorated significantly. As time passed, Chioma learned one of dementia care's greatest lessons. A patient may forget your name, forget your face, repeat the same question dozens of times, accuse you unfairly, or become frightened and aggressive, but behind the confusion is still a human being, someone who deserves safety, dignity, patience, reassurance, and compassionate professional care. Dementia changes memory. It changes thinking. Sometimes it changes behavior, but it never removes a person's humanity. Professional caregivers understand something very important. One careless response can increase fear. One calm response can restore safety. One careful observation can save a life. Mrs. Williams may not remember Chioma's name tomorrow, but in those moments of fear, she remembered how Chioma made her feel safe, seen, protected, and perhaps that is one of the greatest gifts any caregiver can give. Thank you for watching. If this story touched you, please like, share, and subscribe to HealthVerse Comics. Together, we can make healthcare education more human, one story at a time.